Assalamu alaikum wa rahmatullahi wa barakatuh, esteemed viewer. Are you free from all the sorts of ailments, injuries, or mental problems? Well, if you aren't, this is Health Check and it is meant for you. We bring a number of doctors to come and help us understand how to cope and get rid of certain diseases or ailments. And with me today is Dr. Baker Akaturinda, who has been with us several times, will be helping us understand how to cope or how to know the symptoms, the problems, and the facts about depression. We've had this program before, but talking or tackling about men. This time round, it is about women. Dr. Baker, you're most welcome.
Thank you, sir.
You're most welcome. Thanks for honoring our invitations wherever we call you to come and give us a hand in helping the people outside there.
It's a pleasure.
Depression is the topic of discussion today.
Yes.
First and foremost, our viewer would like to remind them what depression can be defined as.
Thank you once again. I'm highly appreciative of being here once again. Host me on the show. Yeah, mental illnesses are real, and we cannot really underestimate them. Most times people tend to think or to fear or to cater for the physical diseases,
Yes.
physical ailments. When a person has malaria, when a person has typhoid, when a person has an injury, physical injury on the body, people get concerned much. But they have neglected the mental illnesses, the psychological illnesses.
Yes.
And today we shall really go through this depression and we shall see it. But in simple terms, depression is when a person loses interest in the things, this time we're talking about ladies, women.
Yes.
When a lady loses interest in the things she used to like, this loss of interest for quite some time.
Okay.
And like I said last time, she may lose interest for a short time and gets like low moods in a short time because of a situation. But naturally, normally, they should overcome it and get back to normal. So when it takes some time, now we classify it as depression.
Okay.
Yes.
Doctor, now, thanks for defining depression, but as it has been a norm here, we have one of our brothers who did not manage to make it to the studios today. He's outside there and he's following us. That is Dr. Musa Sechikubo. He's at his place of work. He didn't manage to come. And your question today is none other than helping us know some of the facts about depression. Dr. Musa, you're most welcome.
Thank you very much for that question. Depression is definitely more common in women compared to men, and it also varies. Depression varies by the time or the season of the woman, the age of the woman. Is it married, unmarried, reproductive age, not reproductive age, postmenopausal, not postmenopausal? And the reason why I think this may be true, that women are more predisposed to depression compared to men, is because of their function, which the functions which they carry on in the household. It's the woman who will be pregnant, and sometimes they have complications of pregnancy, including vomiting, falling ill regularly, feeling hopeless. If there are no support systems in the family which can help her to overcome or to manage some of the complications of pregnancy or the challenges of pregnancy, it may lead to depression. And some of them will have, possibly after such a long and difficult pregnancy, they may end up having a stillbirth where the baby dies, or they may end up having a miscarriage. The first person who is heavily impacted by the loss of a child is still a mother. And that's why you may find that most of them may suffer depression. Even those who end up with live babies, the illness of a child impacts differently between a man and a woman. So depression in women, I would say that it is more a function of their responsibilities than their gender, meaning that they are more prone to depression because of their social roles in a household. including taking care of the children, looking after the children, being pregnant, breastfeeding, looking for food in the household, making sure that everyone in the household is comfortable. So the huge role, the huge social responsibilities which they carry predispose them more to depression compared to men. I'm not saying that the men are not having social responsibilities. They also do have their social responsibilities, but they are then those recurrent physiological activities that occur in a woman and require her to be at the forefront of taking on those responsibilities. And we think if they're not enough, some of the responsibilities, yes, there can be support structures in place that can help reduce the burden on the woman. If you have a supporting husband, or if you have older children and you get a newborn baby, maybe they can help you to look after that baby in terms of carrying them, cleaning for them. But where those support structures are limited or non-existent, the woman is likely to suffer from depression. But others are not, there is nothing like a support structure. Like if someone has painful menstruations, there is no support structure which will reduce her suffering. It is her and her alone to overcome that problem, which is a physiological problem. If a woman is vomiting a lot during pregnancy, it is her and her alone. There are no support structures which will be in play to reduce her burden. It's only her who will have to carry that burden. So yes, depression is more common in women than men, but it's possibly because of their social responsibilities that they carry. Thank you very much.
Okay, that is Dr. Musa there for you.
Yes.
Doctor, now I get back to you. Having
Yes.
had such an explanation and wonderful research from our brother there, Dr. Musa Sechikubo.
Yes. Today, there are very many causes of this depression. Of course, risk factors, they move hand in hand.
Okay.
The first I can't fail to mention is gender-based violence. We have seen, especially in our communities in Africa, where women are even beaten, physically assaulted.
Yes, true.
Yes. And a man beats the woman today, the woman becomes patient. Tomorrow, the following day, and she later gives up. Says, to hell with this thing. So the gender-based violence, which is common in our societies, tend to get women get depressed. They feel they don't have any dignity in them. They feel they are not worth anything, because whenever the husband gets home, it is beating and kicking and so on. But also in that gender-based violence, there is the psychological torture that women go through.
Yes.
Psychological and emotional. Remember, in our definition of health, we say it is not only the absence of disease or infirmity. It is the well-being of the body, the spiritual part, the emotional part, psychological part. So because some women are emotionally tortured, physically, psychologically tortured, like they are not, their dignity is lowered by their husbands,
Yes.
or the males who stay with them, places of work, or maybe family and whatnot. They tend to be depressed and they feel, me, I'm not worth anything, because they have told her, you are nothing for several times. And she ends up getting depressed. Naturally, women are supposed to give birth, to get pregnant.
Yes, yes, true.
Pregnancy is also one of the causes of depression. There are some instances where a lady gets pregnant and actually raises her self-esteem. Say a married lady, she's married, she's expecting to get pregnant, she gets pregnant. She gets happy. But there are those who get pregnant when it is not planned.
All those that get married but fail to get pregnant.
Yes, it's also an issue. Failure to get pregnant. But also getting pregnant when it's not the right time. Say, for example, a girl is in school. She is still in school, doesn't expect to get pregnant at that time.
Yes, yes.
Maybe the boyfriend is also a student. They don't have any plans for pregnancy. Now, when she gets pregnant, depression sets in. She feels disappointed with herself. she begins thinking of going for abortion, which is also risky.
Another problem.
Another problem. So it becomes a big challenge to them when they have that, when they get pregnant, in a times when they are not sure and ready of the pregnancy, or they are not sure of the father of the pregnancy. I also can't forget to mention, among other causes, the challenges of balancing work and job. Because, like you know, women are supposed to keep a home. Yes. Naturally, women are supposed to keep a home, keep their husband, keep their children, like that. Now, in the cases where a lady is working and her work schedule is so demanding, now she has stresses from home, stresses at work, and she has to balance them as a person, a single person.
She's the manager at home, and at the same time, her workplace is taking over. It's
also demanding her, yes. That balance of responsibilities causes many women to get in depression. Okay. Because they fail, they are completely overwhelmed with responsibilities. They are completely overwhelmed and they fail to balance, where should I prioritize first? My home, my family, or my workplace? Family, she needs the husband and the children. Workplace, she needs the money. Like I talked about the responsibilities and the what. Yeah. So she ends up depressed. Some of them end up in a serious condition that they require medication. Others just require some counseling and they become fine. But the point of balance is a big challenge, is a big cause of depression to these ladies. Then also, is what you call infertility. You mentioned the failure to get pregnant. A lady gets married, 1 year down the road, no pregnancy. The second year, the third year, the fourth year, the fifth year, the man gets another wife. Of course, in some beliefs like the Muslim faith, having a second wife is allowed. But there's a difference between having a second wife normally and having a second wife because this one is not giving birth.
Yes.
Because of infertility.
Yes, yes.
So that one pains much and costs them a lot, those ladies. So infertility is one of the causes of depression. Okay. She feels now, why am I married? Why am I even alive? Because naturally women are supposed to give birth, procreation. Now she sees herself, she's infertile. She begins wondering why is she even married? Why is she even alive? And so
life turns out to be meaningless.
Exactly. Those harmful thoughts come in because of infertility.
It seems depression is becoming a problem to the extent that I didn't expect it to be.
It is.
What might be the complications that comes with it? Because itself is so worrying.
Yes, true. Thank you. One is poor concentration at work. Poor concentration, both at work and even at home.
At home, yes.
Because now she feels she's not satisfying what she should satisfy. She feels she's worthless.
She has a lot on her head already.
A lot on her head. The example, if you can take a lady who has infertility, who's not giving birth. Now, even if she was working hard, now she feels no need for working. After all, I'm not important, I have no child.
And whenever such women look at the newborns, I mean the babies or children, they feel
they get more depressed.
I wish this one was mine.
Exactly, they get more depressed. So they lack productivity. The productivity becomes low because now they no longer feel they are worthy. Another point is you can have a family breakup. The man feeling tired of the woman who's not giving birth, for example, infertility. But also, generally speaking, when a woman is depressed, the family responsibilities are not catered for well.
100%.
Yes. So usually the family breakages, they come up. Another point I can't fail to mention is loss of job.
Okay.
Because now this one at work, she's no longer productive as she used to be. Now what should her boss do? Her boss expects output. And now the boss will think of employing another one.
Yes.
So that's job loss.
The boss will think of a substitute.
Exactly. Then in the end, we get back to the issue of poverty. then now poverty sets in. I can't fail to mention that depression can also cause now physical diseases.
For
example, skin diseases.
Sure.
Because now she will no longer care for her body, so now diseases now use the chance and they set in. There are others who even go to the extent of losing hope completely, and if they, especially women, and they go for prostitution, which we say sex for money. And in doing so, they get themselves the STIs. I also can't fail to mention in this depression that when they are depressed, they even lose touch with their people.
Doctor, before we go to our viewers, we need to know, now that depression has come in, my wife is depressed. It is a problem that is so complicated to the extent that none of us, I mean I and the viewer outside there, that none of us thought it could be. Assuming my wife is depressed, how do I know? Because I need to help her.
Very wonderful. Yeah, thank you for that.
I'm asking about the symptoms now.
Yes, true. Any disease has symptoms and signs which we can tell and say, this one should be having this disease. And once we know them, it's very important. And we must know them because they will help us to know that a person is depressed. Like I said, these are not physical diseases that a person has a headache, a person has a pain here. No, they're psychological. So one of the signs is disrupted sleep. A person goes, works, comes back home, sleep is not there. It gets to midnight, the person is still awake. It gets to 2 a.m., person is still awake. So that can be a sign that the person has depression, when sleep is not normal. The cycle of sleep is disturbed when a person has that depression. Another point which I can't also fail to mention is self-isolation.
Okay.
The
She
person
needs to be alone.
The person who used to be jolly every time with people coming and greeting you, what. Now you say person comes home, maybe goes in the bedroom and be with herself alone. Then in the beginning wondering something must be wrong. She must be depressed somewhere.
Okay.
Because by the time now she is no longer social the way she used to be. Now she wants to be alone. It means the negative thoughts have set in of depression. It means now she feels she's not worthy to be with the people whom she used to be with. Now she becomes self-isolated and she wants to be alone. Another point, you watch how they talk. They have reduced words, reduced talk. They rarely can sustain a conversation. The person who used to talk for some hours now talks a little and keeps quiet. Ask her, madam, how was the day? Fine. Keeps quiet. How was work? Fine. Of course, they may not tell the truth that things are not moving on well. I am disappointed. What? You see, I even don't have a child. I'm not taking it serious.
They are no longer interactive.
They are no longer. You may even wonder what's happening. Because when you say, how are you doing? She will say, fine. Keeps quiet. What's the problem? I'm fine.
Nothing.
Keeps quiet. Nothing. But they are not explaining what exactly is happening.
It's happening to them.
Whereas previously, anything can happen, they can tell you, this happened at work, today the work was not nice, we had this.
When I went back home, power was off, and I wondered, how am I going to iron my clothes for work tomorrow? There's always that interaction.
The person is interactive, yes. But now in depression, they speak one word and keep quiet. One word and keep quiet. That's why we said in the complications, breakage in marriages are common. Because now, you as the man, in this case a woman is depressed, you as the man, you may not even understand why she's behaving like that. You ask her what's the problem, tells you no problem. Yet, a person is isolated, a person is alone, a person is not in her moods, and is telling you, there's no problem, keeps quiet.
Everything is well.
Everything is well, no problem. But you see there's a problem. So, the reduction in interaction
Thank you so much, Dr. Baker Akaturinda. The program is getting more interesting. And for those that have joined in, this is Healthy Check, and your host is Nambale Bashir. This is the time that I promised our viewer that we shall be connecting to you. And indeed, we have our correspondent down in the streets of Kampala, and he has found us someone. Who is it? We need to know. Let's connect to our viewer.
Assalamu alaikum wa rahmatullahi wa barakatuh. By the names I'm called Mukaya Shawal, and my question is, depression is thought to be madness by most people. What does the doctor in the studio say about this?
I like his question, and it is very common. It's common.
Okay.
People say that one is mad. This is madness. This is madness. But I really appreciate him for that question, because I think I hadn't thought of explaining it had he not brought it. But thank you so much, the one who asked this question. It is very important to look into. Number one, it is not madness. Let me first say, I encourage everybody to have that off their heads. It's not madness. This is a mental disease. This is a disease the way you can have malaria.
Okay.
Because in malaria, a bacteria or a parasite bites you and you get malaria. Now in this case, situations around you
are the parasites.
Are the parasites, we can say are the parasites, which infect, now let me say, your mental body, let me say so, and you end up getting this disease, this mental illness.
Okay.
The situation this lady is going through, and the way she is reacting towards them psychologically, the way the psychology is responding to what she's going through,
okay,
will lead to this mental illness. Not mad per se, because when you use mad, it is a heavy word, which is not in this case. In this case, it's just a mental response to what this lady is going through. When it overwhelms her, she gets in depression. Like I mentioned, if I can repeat, it is not that when a woman faces a negative challenge or faces a problem, immediately they get depressed. No. They may face them and they endure for some time.
Okay.
Their psychology, their mind responds. For example, take an example. She gets married, takes one year without a child. She may not get depressed. She may have some hope and wait. Takes a second year. She may say, let me wait and see. When it gets to 5 years, you see now the response of the mental response. Mm-hmm. The challenge is there, the problem is there. She has persisted for long and it's not going. So she ends up getting depressed. So it is just the mental response, the psychological response to a problem which the woman is facing. Okay. Not necessarily madness. She is really not mad. And actually, if that problem is removed, for example, we encourage those, if they get those challenges, they go to hospital, for example, infertility. Mm. And we check for the cause. If it is removed, the woman becomes fine. I also can't fail to mention and say, this is not madness, because everybody goes through those depression. But now the level matters. Of course, like I said, whenever a problem happens, everybody gets disappointed, normally. Any woman who, for example, who gets a failed relationship, they feel like, oh my God, why is this? Disappointed somehow. But now if it goes several times, then it becomes overwhelmed. Yes. The mind no longer cannot control it anymore. Some of them break down and they fail to work even. They get depressed. So it is really not madness, but it's just a mental condition which arises from several challenges that
Doctor,
the mind
now,
fails to.
Let's talk about the treatment. Does it have any treatment? Or before we go to that,
yes,
how does one cope with it? I mean, they have it.
Yes.
They have a lot of problems around them. Mm-hmm. How do they try to fight? How do they learn to live with such problems?
Yes, thank you. Very important, very important. Because, like we mentioned,
Yes.
problems will never get finished in life.
True that.
As long as this woman is alive, she will face problems. No doubt about it. So we should encourage them to go to support groups. They go to support groups and they go and ask their fellow ladies how life is going. Because they may find the challenge, what they are calling a big challenge, that others have worse challenges more than them, and they are coping. So encourage them to go to support groups, and they talk to their fellow ladies, and they see how things are going, and they go over it.
They see how other women are managing.
Yes.
Let's now, doctor, talk about treatment, because time is chasing us.
Yeah, true. Thank you once again. Again, treatment, I always say, the best treatment for mental illness is counseling. They go and talk to a counselor.
Counseling or rehabilitation.
Exactly. They go and talk to a counselor and they explain what they are going through and advise them how to cope. If it's job issues, you see how to talk with your managers and you discuss and you see how things are moving. Family issues, they talk to in Uganda they are called the uncles and aunties. They sit them down and discuss with
family
them.
counselors.
Yes, they counsel them, tell them how things should be made, how to persevere with each other, and life moves. Before I can't fail to mention this also, the spiritual part of it, very important. We encourage women to go to the mosque and do their prayers. If they are Christians, go to the church, do their prayers. Whatever religious affiliation they are in.
In a nutshell, they should not forget their Creator.
Their Creator. They should know there is someone supreme above them. There's someone who's watching over them in their situations.
Who won't find a problem in solving their problems.
Exactly.
Thank you so much,
Yes,
Doctor.
yes.
We are unlucky to say that time could allow us only to share with our viewers 30 minutes. But next time, inshallah, we shall invite you still and help us understand a certain topics or diseases in as far as helping our viewers is concerned. Our beloved viewer, this is what time could allow us. We can't go beyond this. I remain your host, Nambali Bashir, and until we meet in the next episodes, inshallah, assalamu alaikum wa rahmatullahi wa barakatuh.